I'll defer to Senator Braun.
Thank you, Mr. Chair. I come from the world of fixing issues. I ran a company for 37 years. It was so little, many of the issues didn't even come to the forefront because you were worried about turning the lights on in the morning, off in the evening, and all the stuff that happened in between. I was lucky enough to take a little hardscrabble company and turn it into a national distribution logistics company. Biggest thing I wrestled with once we got larger was the high cost of health care. And now we've not only got that to contend with, we've got the issue of how are you going to get people into the business of it when it's the largest sector of our economy. Travel, all 92 counties in Indiana, workforce. It was a bigger issue now than it was pre-COVID, and that's what I heard mostly pre-COVID. I can say one thing, if you give good benefits, you pay your people well, folks come to your door to work there. I weigh in on those issues a lot, and every company is going to find its own way to do that. But let's look at this issue. I don't think that we'd want to look to the federal government to take on something so granular when currently we borrow 30% of every dollar we spend here. I don't know if you know that. It was about 20% when I got here just 4 years ago. Terrible long-term business plan. We're not going to be able to solve anything by borrowing money from our kids and grandkids, and that's what this place does. Let me turn my attention to what I think would work. I think companies, I think the healthcare industry, let's focus in on what we're talking about, has now become so top-heavy where doctors, the practitioners, are wondering if it was even worth it to get their degree. Nurses as well, analogous to farmers in big ag, had a startup recently in Indiana where a bunch of anesthesiologists and surgeons wanted to start their own practice. It was almost impossible to do. Most of them got fired from their hospital they were working for. Let me tell you what they were able to do. They were able to take a gallbladder removal that cost $21,000 in Indiana if you were covered with insurance, $32,000. That's bizarre if you didn't have insurance but could afford to pay for it. They're doing it for $8,000. And they're going to pay themselves twice as much in terms of fees. That is what's got to change basically, or you're not going to have anybody wanting to get into the industry. And until you fix the industry itself with competition, transparency, removing the barriers to entry, making it entrepreneurial, the whole idea of getting people to work within it is almost going to be a secondary consideration. So now let's get to the matter of what we're talking about here, workforce in a broken industry. How do you improve upon it? Well, number one, I wouldn't look to this place. That ought to be something that would be easy among the people in the business. If you're occupying 18 to 20% of our GDP, you ought to be making some effort to do workforce through your own businesses, which now is mostly hospitals, over 40%, pharma's 15%, practitioners are shrinking because they're going on the payroll of hospitals, and then you got insurance, which is kind of the Darth Vader of the whole industry in terms of getting to any of this, getting fixed. I would say, because I was on our school board locally for 10 years, this ought to be something we're doing better K through 12. Look at the parents that regret that they didn't have some guidance somewhere along the way in high school or back in middle school that don't pursue a 4-year degree when only 35% of the jobs need it. I get 10 people show up for that when I got one open. I'm lucky on a Friday if 3 people come in for a job that would pay as much as most 4-year degrees that they show up on Monday. And we got to get that figured out. Better guidance in high school, starting to take high demand, high wage jobs, which nurses would be one of them. Doctors, if you can put up with how long it takes to be educated and not to be frustrated once you become one, we need to do that back there where you live within your means and you get results. Dr. Sewani, I'd like you to comment, and anybody else fairly briefly. Should we be doing more here, or is a solution getting better value when they're in K through 12, especially middle school through high school, for the problems we're dealing with and talking about here?
I think partnerships are important. I think we need to work together, and we've done some of the programs you've described. That's exactly what we've kind of done. We've got the high school apprenticeship going to our high schools, partnering with our high schools, creating that nurse apprenticeship program to keep them to graduate high school and then become LPNs and then move up. Those programs that I described in my statement have all been supported through the Oxford Health System. But to scale them, we need support from our universities, we need support from our community colleges, we need support from our government. So I do think it's a partnership.
Good news, I see that happening back in my own home state. Anybody else want to weigh in on that? Yes, sir.
Thank you. I want to make a point that's often missed, which is our health care is actually sick care. And if we focused on keeping people without the need to see a doctor be hospitalized, that's the solution. And some of that $4.3 trillion we spend on sick care, if we reduce that by 10%, we'd have $400 billion to invest in public health. And that's exactly what we should be doing, in my humble opinion.
Amen to that, because I'll part with this. Back 15 years ago, when I was sick and tired of hearing how lucky I was that it's only going up 5 to 10% each year, I was large enough to self-insure. I found out they were making 25% profit margins on the plan I had in place, and the insurance companies told me just what you said. Ounce of prevention worth a pound of cure. Avoid the business we're in. I took it to heart, paid for 100% of wellness, skin in the game from $1. We have not had a premium increase in 15 years, and I got a healthier profile of employees. Thank you.